So people ask me, why do I think that I'm really good at what I do? Because I'm a nerd. And a nerd does one thing over and over and over again, because this is the way you become a master. We do about 200 halo surgeries a year. We are nerdy. We do research. We found a new ligament that has never been described in the history of anatomy up there. We have different techniques for different scalp shapes, and we understand, most importantly, the psychology of a patient. Halo patients have a different mindset than patients that are seeking aesthetic facial surgery, like a nose job or a facelift. Those patients feel ashamed of their forehead, and they just want to look normal and not as exposed as they feel all the time with an overly high forehead. Also, I think results speak for themselves louder than any words of any surgeon. Thirdly, I am a big believer of all the little details that create a big picture, and this starts way before surgery when we provide you with information. You need to know what is the benefit of a surgery, just as you need to know all the risks of the surgery. How long is the recovery? What is the patient journey? Especially, what is the patient journey for a patient that is flying into London? All this information needs to be provided to you so that you can make a good decision. Going to surgery, it's all the little details. How do we cut? How do we sew? How do we make sure that hair will grow through the scar? And then also the recovery. How can we expedite your recovery? There are tricks in my box. I did a PhD in scarring. I have a lot of interest in giving you the best possible scar. And a good scar to me is a scar that you and I find and nobody else. I spend a lot of time talking to my patients in order to understand where they come from, and I can say I get it. This is not an aesthetic procedure like a nose job or a boob job, even though everybody else you talk to doesn't understand what you're talking about and they think it's just a vanity project for yourself. No, this is just to look normal and complete and not be distracted on an everyday basis by situations other people don't even pay attention to, just like windy weather or going for a swim. And lastly, I do believe you can only get good at something if you're really passionate about it. I get my fuel out of the reaction of my patients when I see women coming into my clinic feeling very self-conscious about themselves, and we do the surgery and they come back with a tight ponytail even though it's raining outside and they couldn't care less, and they're actually happy to show their forehead to the world. That's a pretty good feeling to see this transition.